morning, everyone. I am Dr. Tanmoy Mandal. I am a medical oncologist by profession, and we have here two other doctors also. Dr. Suranjan Mukherjee, who is a pulmonologist by profession, and Dr. Ashutosh Daga, who is also a medical oncologist by profession. So today we have gathered here just to have a small discussion on what is lung cancer, how it behaves, and what are the malignancies, what are the risk factors for such that is the discussion what we are going to be having today. So lung cancer, as we know, is one of the leading cause of cancer death amongst men and women in both states and even in India. So in 2020 also lung cancer ranks amongst the fourth leading cause of cancer related deaths in India, which amounts to around 7.8% of the deaths, and around 5.5% of the new cases which are diagnosed every year. So what the main issue with lung cancer is, it's mostly diagnosed in later stages because the presentation is in that form only, because whenever the patient presents to the clinic, they mostly present in a later stage. So there is a role of screening and regular checkups for that. If it is able to be diagnosed at an early stage, it becomes helpful, and we can go ahead with further treatment options so that we can achieve a cure in most of the patients. That's what the goal is. So it's this the more important points. So what are the risk factors? So risk factors of lung cancer, mostly it's smoking. What's related? Exposure to second-hand smoke is another cause. Previous exposure to radon gas is one of the cause. Exposure to asbestos and other carcinogens, and some previous radiation therapy which was earlier done in earlier days in some cases with Hodgkin's lymphoma or some other patients like that. So these are the common risk factors. So now I think we can go to some questions. So Dr. Suranjan Mukherjee, so what are the risk factors of lung cancer development, mostly in the smokers, because smoking is very common in India and also in worldwide also. So what are the risk factors which leads to the development of lung cancer, mostly in the smokers?
In the smokers, actually there is the risk of lung cancer, and particularly the squamous cell type of lung cancer. And but in India also we see a lot of lung cancers amongst non-smokers, which we think it probably has got a genetic basis. And of course, the smoking duration and the cumulative years of smoking would amount to increased risk for lung cancers. And it's always good to quit, because 10 years after quitting smoking, the risk of lung cancer comes down to about 50% than before.
So the main motto is that we need to stop smoking at any point of time, and even if we think that as we have smoked for so long, it's already the time has passed, but it's not like that. Even if we stop smoking also, and we spend quite a long amount of time even after stopping of smoking, then also the risk of lung cancer might be reduced. So it's not that smoking itself, stopping smoking is not helpful, it's also helpful. So we need to stop smoking. That's one of the most important messages in every awareness camps where we do, in every awareness programs where we do for any cancer. So are there the chronic lung diseases like COPD or asthma or interstitial lung disease? Are they also related to development of lung cancer?
When you say interstitial lung disease, is particularly the entity called the idiopathic pulmonary fibrosis, which is of course a progressive fibrotic lung disease, and definitely there is an increased risk of lung cancers, even in COPD. But actually COPD per se, I mean, if you adjust that for the smoking, then COPD itself doesn't it's not a risk factor for lung cancer. However, the other fibrotic lung disease are also risk factors. One thing to mention that in our country or in the Asian countries, you have got a high prevalence of TB. Now, post-TB fibrosis develops in many of these patients, and scar carcinoma can develop from these fibrotic areas. So we have to be quite vigilant about that.
Right. So next, I think Dr. Ashutosh, you can take this. So what are the symptoms for development of it, or what we see in lung cancer, symptomatic?
So symptom wise, most of the patients will present with symptoms of cough, or they cough with blood, which we call as hemoptysis. There will be a progressive weight loss. Sometimes there might be repeated infections or fevers because of those repeated infections. The very non-specific symptoms, and you need to be very much vigilant about that, because we think that it's mostly cough and cold. We take antibiotics for that. We try to consult different doctors that this particular cough is not subsiding with the medications also. But I think that might be one of the indications that you need to get some form of imaging or CT scan just to pick it up early. So that is what you were telling it earlier, that most of the symptoms are non-specific, and because of that, most of the disease was picked up in an advanced stage.
Right.
Actually, it's interesting that most lung cancers in the early stage won't produce any symptoms, and that's the danger. It will only produce symptoms if it is central and it's involving the airways, or if it's peripherally involving the pleura or the chest wall. Now, somewhere in between, unless it grows to a big size, it's
So that's the main issue. Many times what we see that early lung cancer is picked up incidentally when I think we go for doing a laparoscopic surgery of a gallbladder or whatever hernia, and a routine chest X-ray is done, and on routine chest X-ray a small opacity or a shadow is picked up. In such cases, incidentally some lung cancers might be detected, which might be early, and this is what we see in our practice also in some situations.
And one more thing, interesting, I've seen quite a few cases. I need to make people aware. Patients not uncommonly have come with a shoulder pain, so or upper chest pain, and it has been sort of considered as a musculoskeletal pain, a pain in the joints, and physiotherapy, etc. The chest X-ray shows a Pancoast tumor or the right upper lobe tumor.
So the investigations wise, how we diagnose a lung cancer?
So first and foremost is there are two parts of investigation. One is the diagnosis. So in that we do a true-cut biopsy from the lesion, and the second is the staging. For that we usually do PET scan. Apart from this, if suppose somebody is having early lung cancer, means stage 1 or stage 2 or early stage 3, where we contemplate that we can undergo a surgery. So in those cases, we might need to do a further test like VO2 maximum, DLCOs, thoracoscopy, mediastinoscopy, just to stage it properly and to term it as an operable, medically as well as surgically operable lung cancer. If somebody is diagnosed as a stage 4 in PET scan, I think the rest of the investigation will not be required. Apart from that, routine investigations like the routine blood workup, echo scan, ECG, just to know a proper fitness of the patient. These are the basic investigations which we do for any lung cancer.
So, sir, does a lung biopsy increase the risk of spread of lung cancer? This is what we face many times in the OPD, that patients ask that if we do a biopsy, is there a risk of spread? And we know that there is no risk, but yes, the guests might be wanting to know this, that I don't think there is an increased risk.
No, not at all. I think it's on the contrary, it should be always biopsied. There are reasons for that. I mean, first of all, there are different types of lung cancer, and treatment will depend on the specific type of the cancer. Secondly, in the modern personalized treatment for lung cancer, we need to know the molecular status. And also special stains to find out that, which gives us a lot of information about what treatment to give, what chemotherapy, what will work, what won't work. Right. So biopsy is very important.
Right.
And also, we are sometimes surprised that biopsy has shown TB.
Right. This also might happen in some cases.
Yes.
It's not that opacity in the lung always goes to be a malignancy. It's not like that.
Yes.
So any screening test for early detection of lung cancer, do we have screening programs in India?
No, we don't have a screening. It's actually a sort of annual screening by low-dose CT scanner with a specific patient criteria fulfilled about smoking and the age. And it has been established as a low-dose CT scan as a screening way. I have to sort of re-emphasize that chest X-ray is not at all a tool for screening.
Yes. Routine chest X-ray, suppose 6 monthly or 1
No,
year,
not
it's not a routine.
Exactly.
Not a screening. Right. So next, I think regarding the treatment, certain points. So the newer modalities of treatment, what we see that immunotherapy has has come a long way and it's becoming big. So is immunotherapy effective in lung cancer? This is what.
So the context which I'll put in this is started with a stage 4 lung cancer, and initially we used to give immunotherapy only in stage 4 lung cancers, but over a period of last 2 or 3 years now it has slowly come into stage 3, and now even before surgery we are giving immunotherapy. So why we are talking so much about immunotherapy? Because previously lung cancer was such a difficult disease to treat that we were not having long-term remissions, we were not having long-term controls with any of the drugs. But we have now patients who are taking immunotherapy for years together, and who were initially diagnosed with stage 4, and they are continuing treatment for almost 3-4 years, and they are absolutely fit, fine, and undergoing their normal routines, daily activities, their normal lifestyle because of a simple injection which we give every 3 weekly or 2 weekly as per the schedule. So yes, immunotherapy has worked wonders. I think immunotherapy is a way to go in lung cancers. When to use, where to use, what to use, I think that is the point of different discussion. But yes, immunotherapy has a very important part in lung cancer.
Okay. So I think with this we end the treatment part also, and certain myths regarding lung cancer, which I would be saying that we have many myths and many are bothered with that. So some myths are that if I smoke, there is no point in quitting. It's a wrong statement. We need to quit smoking. That has already been elaborated by Dr. Suranjan Mukherjee. So next is that lung cancer occurs only in men. It's a wrong statement that it occurs in men. Now what we see that in Asian non-smoker females, the incidence of adenocarcinoma lung is increasing. So it's not that it only occurs in men. Female also have the risk of development of lung cancer. I can only get a lung cancer when I am older than 60 years. It's a wrong statement. It's not that it occurs only in the elderly. Now it is becoming that it's becoming more early and early. So the lung cancers can occur at any age. So lung cancer screening causes lung cancer. It's a wrong. Lung cancer screening doesn't cause. And in India, actually, we don't have a screening program in place till now. Everyone receives the same treatment for all types of lung cancer. This is a wrong statement. The treatment is of course personalized. Someone might require a tyrosine kinase inhibitor, someone might require immunotherapy, someone might need a surgery, radiation. So there are different modalities. It depends on the stage, on the type, the molecular pattern of the treatment. So, and lung cancer surgery makes the lung cancer spread. This is a big myth. Lung cancer biopsy makes the lung cancer spread. This is also a big myth. And if I had lung cancer, I have symptoms. So mostly lung cancer presents at a later stage when they are symptomatic and heavily spread. And lung cancer is always terminal. It's a wrong statement. Lung cancer, we detect many lung cancers who are either stage 2 or stage 3. Stage 1 is of course less seen earlier, but stage 2 and stage 3 we commonly see. And smoking is the only risk factor for lung cancer. It's not only smoking, there are many other risk factors also, but yes, of course, smoking is the most important risk factor for smoking, for development of lung cancer. So I think with this we can end the discussion today, and we will be having further more sessions like this. Thanks to everyone, and thanks to the organizers.
Thank you.